So thank you so much everyone for joining today. Welcome to the United Nations Legal Identity Agenda webinar. My name is Risa Arai, and then I am a UNGP Global Focal Point of Legal Identity and leading policy development and country support. And I am the lead of this UNLEA webinar series, as most of you may know already. And then today, the webinar is facilitated by the UNICEF Bhaskar Mishra, who is my close colleague from UNLEA Task Force. And they are sharing the innovative practices using the Nigerian example. So we have three objectives here through this session. One is to promote understanding among UNCTs on the opportunities and challenges to increase the coverage of birth registration. And the second one is to highlight the importance of the UNCT coordination by promoting understanding of how birth registration is intersecting with other thematic areas, which are the mandates of different UN agencies on the ground. And then the third objective is to share the good practices and innovative solutions in Nigeria, which can be replicated by other countries to enhance the coverage of birth registration. And today we also have an honor of having guest speakers from the government. They are going to join a bit later. But thank you so much for joining everyone. And then Michelle, Bhaskar, thank you so much for being here.
Thank you.
So without further ado, I'm handing over to Bhaskar, who is a facilitator for this webinar. So over to you, Bhaskar.
Thank you, Risa. Dear colleagues, good morning, good afternoon, good evening, depending upon where you are. My name is Bhaskar Mishra. I'm the Global Technical Lead on CRVS and Legal Identity, working with UNICEF headquarters. As Risa said, sorry, the UNICEF team and the National Population Presenter, they will join after a couple of minutes. They're stuck in the traffic. And so in the meantime, we will go ahead with Mr. Tisse, who will make a presentation on legal review work that Nigeria has undertaken recently. But before we go there, let me give you some perspective about Nigeria. As most of you would know, Nigeria has taken a series of transformative measures to improve the CRVS system in the country. And such measures range from legal review to digitalization to system integration with the health sector. And Nigeria's progress is also critically important for the regional as well as global progress on SDG 16.9. And it has close to 8 million births and 2.5 million deaths every year, the maximum in Africa. But most importantly, the learnings from Nigeria will have relevance for other countries in Africa and beyond. I will introduce other participants when they join. So in the meantime, I request Mitchell, can you go ahead with your presentation?
Okay.
Over to you.
Thank you very much, Bhaskar. And I understand I have 10 minutes, so that's till 13:15.
Yeah.
Good afternoon, everyone. Just kindly confirm if you can now see my slide deck.
Yeah. Can you? Yeah, we can see your slide deck.
Okay. Fantastic. Now, just a quick introduction. So my name is Mitchell Agatise. I'm a senior associate in Olaniwaju LP. It's a leading law firm in Nigeria. And over the course of the past year, we've had the opportunity to work with the UNICEF as well as NPC vis-a-vis reviewing the legal frameworks as it relates to ECRVS and birth registration in Nigeria, as well as supporting to basically plug the lacuna that exists in the underlying statutory enactment, as well as in relation to preparing a regulation to support ECRVS. So this presentation would basically talk through the approach and methodology we took, the key findings we made, key solutions we put forward. So very, very quickly, as it relates to the approach we took on, which was our first work stream, we did an extensive review of the legal and regulatory framework in Nigeria as it relates to ECRVS. Now, there were two key reasons for our review. Number one, we wanted to identify whether, in fact, there was, should I say, legal framework for ECRVS as it exists, or CRVS even. That's on the one hand. And on the other hand, it was also to assess what were the gaps as it relates to Nigeria's, should I say, identity management and data protection as it relates to that regulations and enactments. And the idea was such that we'll be able to, one, identify gaps, as I have said, assess whether or not the existing legal regime was sufficient, and thirdly, to identify whether there were impediments toward rolling out, an ECRVS regime in Nigeria. Just very, very quickly to identify and explain to you, Nigeria has a very unique legal framework as it relates to data management and as it relates to CRVS. On the one hand, the Constitution provides for it and basically creates a form of confusion. In that, within the Constitution, it is more or less entrusted to two bodies, being the NPC, as well as the local government, as it relates to birth registration and death registration in Nigeria. Now, in addition to that, of course, there was the NPC Act, which was an old act that basically, should I say, was made for a time when the processes were manual. Now, of course, we know that things have since moved forward. So our review basically identified, on the one hand, the key legal impediments, right? As it relates to, can we even do this? And if we can, how can we? What needs to change? What reforms need to be put forward? What amendments in the laws need to be put forward? What regulations need to be put in place? And secondly, we also had to assess, aside the impediments, what other things need to be done to update the current legal framework. So that was what we primarily focused on. And in terms of our local law review, primarily we're looking at the Constitution of Nigeria, the NPC Act, then of course, the plethora of case law that had also basically touched on issues such as that. Tangentially, as at the time we were doing this, a very, very key element was data protection, because at the time, Nigeria did not have a Data Protection Act. At best, what we had was a data protection regulation that the force of law it had, as at the time when we're doing this review, was minimal. So we also had to look at how can we build in data protection principles into our reform project? How can we build that into the regulations? Thankfully, while we were doing the work, the Data Protection Act then was enacted. So as a result of that, we made comments toward the final version of the Data Protection Act, such that it also dealt with key issues that we're doing under this work stream. So that was basically the very first step we took. And we have an extensive report, which the UNICEF has, of over 100 pages, where we then identified all these impediments, all these roadblocks, and then gave our recommendations. Now, aside this, we then, of course, as I mentioned, we had identified what we're trying to do, but we had key drivers, right? We weren't just doing this on a tortuous journey. No, we had key drivers that were driving what we're reviewing. We wanted to ensure that there is synergy and data integration between the NPC, that's the National Population Commission, and other key identity management agencies. In Nigeria, we have a wide range of that, primarily the National Identity Management Commission, NIMC, because there seems to be an overlap. And there are a lot of databases, and there was no synergy. So that was a key driver for our review. Another driver for our review was to ensure that NPC, clearly and without fear of equivocation, was in charge of effectively managing and governing that birth notification and registration process. Because if you remember, I had mentioned that under the Constitution, it seemed as though there was some form of overlap or confusion created thereby. So wanted to remove that impediment. Of course, wanted to facilitate the implementation of ECRVS, because in and of itself, it could not fit on the legal framework we had. And of course, as I mentioned, to ensure adequate protection of children's sensitive data. Now, of course, that's one leg, right? That just looks at the local approach. But aside that, we also sought to look at other jurisdictions as well as best practices as it relates to ECRVS and ECRVS frameworks. So we had a selection matrix for jurisdictions that we identified. And we were trying to ensure that we got jurisdictions that have conformed with best practice guidelines, that have a robust legislative framework for this, that already have digitized the birth notification and registration process, that had a strong data protection framework, and which is adaptable to the Nigerian legal system. Because it's all well and good if you have all of that, but it cannot be adapted into how our legal system creates the foundation for things. So as a result of that, we were able to identify a number of jurisdictions, which also fed into our insights that, of course, came into the reports we issued and eventually the bill we drafted and the regulations. Of course, we were able to identify other indices that we looked at. So of course, I've touched on this, but on the screen, you can see some of those indices that we wanted to identify. How has it been done elsewhere? Because these are the indices we have seen from best practice. And secondly, and in addition, I would say, how can we then transpose this into our system? Now, when we had identified the gaps, when we had distilled recommendations from international best practice, what we then did was that we then looked at, okay, now we have all this information, now we have all this learning, now we have all this insight. How then do we bring it to Nigeria? So what we did was we took the Birth and Death Act. So we have a Birth Death Compulsory Registration Act. We updated that to bring it in line with CRVS best practices, right? We also, of course, took a step further. We looked at things to ensure that we can indeed have that process seamlessly implemented for issuance of birth certificate and national identification number at the point of birth registration, which is best practice, but is not consistent with what we had beforehand. We looked at harmonization of the entities that deal with data, such as to have efficient data management, and of course, other elements such as digitization by hybrid system of notification and registration, both for electronic and also understanding that our unique circumstances still requires some form of, for example, paper-based in specific instances. So for example, ultra-rural areas, but with a mindset toward eventual digitization. And of course, I mentioned we brought in data protection principles into the act, which was non-existent beforehand, and which was at a time when the Data Protection Act in Nigeria was not passed, although it has since been passed. So in a nutshell, the highlights of the draft we've put forward, it is not yet law in Nigeria, but we are hoping and praying that it diligently so becomes soon. We clearly articulated the objectives and the application of the bill, such as, to the extent necessary, to cover the purpose and scope of ECRVS. We ensured that there was clarity as to the institutional architecture, right, dealing thereto. We ensured there was an establishment of the database, right, an electronic database, because of course, you can't say you have ECRVS if there's no electronic database. So we put that into the law, such that that ECRVS database exists and can ensure or enable these ECRVS processes. And of course, other issues which are on the screen, including interoperability, right? Because as I mentioned earlier, in Nigeria today, we have a number of databases scattered all over the place. We have immigration databases, we have NIMSI databases, we have driver's license databases. We need to bring it all together, such as to ensure that indeed this is a true database that covers the whole hog of vital statistics. So we have a number of core provisions in there, including certification, proof of identity, but all of this stems from best practice, as I've said earlier. So I have just 10 seconds left. So I think this is a good point to thank you for your time. Thank you very much.
Thank you, Michelle, for a very insightful presentation, and congratulations for an excellent work.
Thank you. Thank you.
And I see that Ridwan has joined, but Ibrahim and others are still not here.
I think Sharon has joined.
Yes. So, Sharon, are you ready with the team?
Yes, I am.
All right. So, Ibrahim is also there, and the director from
Yes.
NPT.
Yes, the director.
Yes, Bhaskar, we are connected.
All right, sir. Thank you very much, Ibrahim and the Nigeria team, for agreeing to have this webinar. Okay, and we utilize this time to have a very good session with Michelle. Okay, and then It was very, very informative. So Ibrahim,
you.
now I pass on the
Good
floor to
afternoon,
you,
Sharon Ibrahim.
and then we go straight to presentations. Over to you, Ibrahim.
Good afternoon, Bhaskar. Good afternoon, all colleagues. This is a very big opportunity in terms of trying to give a sort of an optics regarding the journey so far traveled by Nigeria when it really comes to CRVS, and more especially our story with regards to the use of digital technology, local solutions, and how we've really come too far from where we were until today, whereby our focus is basically to see that in a seamless way, the births of children are being registered, certificates are being issued, moving away from 57% and then trying to really have a very positive slant regarding birth registration so that we'll be able to achieve the SDGs. Without much ado, I should be able now to really, I think you should have the presentation.
Sharon has the rights to display, okay?
Just a moment, Bhaskar.
Yeah, it's okay.
Bhaskar, allow me to introduce Mr. Matthew Temida, is the Director of Civil Registration, is here with us. He will take his own presentation right away. Then I'll come in later.
All right.
Because that's how we have arranged it. All right, so over to Mr. Matthew.
Good afternoon, everybody. Let me use this opportunity to thank the organizer for this webinar and to thank most especially UNICEF Nigeria. Without taking much of our time, let me go straight to the presentation. As regards the legal framework, the Birth Death Compulsory Registration Decree 39 of 1979 gave the Commission the power to establish a universal system of registration. And this law was backed up by Act 69 of 1992, otherwise known as Birth Death, etc. Registration Act, which gave the Commission the authority to register all vital events. And this act is reinforced again by the 1999 Constitution of the Federal Republic of Nigeria, which further strengthened the mandate of MPC to establish a universal system across Nigeria, including all local government areas, all wards of the Federation. CRVS in Nigeria is centralized and administered by the National Population Commission from the
Sorry, we can't hear you. Hello? Ibrahim? Ibrahim, can you hear me?
Yeah.
Yeah, so over to you guys, Ibrahim and the team.
Yes, thank you so much, Bhaskar. Out here, we have the chairman of the National Population Commission, the gentleman who has got the statutory responsibility to civil registration and the national population census, Dr. Koyin Country. So also we have a man. My name is Master Isakora. Good morning to you all. Can you show us in terms of a video, in terms of from our side here, Oscar?
Okay, all right. So I'm all right. You want me to stop sharing and you will do it?
No. You will do it, but you have a video for our room here, so that we introduce the chairman as well as the director for civil registration.
Okay, all right.
Thank you. So in our room, as I've mentioned, we have the chairman for National Population Commission. He has the statutory responsibility to oversee civil registration in Nigeria, and of course with the national population census. And on my far right, that is Matthew, whom you met in Addis when we had the technical meeting for civil registration. So he is also here with us. And Sharon, whom you know, she's also here. So basically, we are all set, and I quite believe we've just kickstarted the issue with regards to the legal reforms that are really happening in Nigeria under the oversight of National Population Commission with our very astute and the steering that is really coming from our chairman. So he will just say a few words and then he will pass over to Matthew. Over to you, chairman.
Yeah, good morning.
Good morning, sir.
Yeah, how are you?
All good, sir. Oh, we're delighted to have you here, sir. Thank you for that. Over to you, sir.
Thank you for arranging this webinar. It's very, very important for us to share with you our experience in Nigeria and the support we'll be having from the UNFA team here in Nigeria and all our stakeholders. We're doing very well, and we're looking forward to working towards achieving the SDG 16.9 by the year 2030. Good morning.
Thank you.
Thank you, Pascal. So over to you. The chairman has already made his commitment. 2030, SDG 16.9, still a legal identity for all, including birth registration, will be achieved in Nigeria. A very strong political commitment that is really coming from the highest level to see that this is being attained. So we'll now leave Matthew to continue the presentation with regards to the landscape in terms of civil registration. Over to you, Pascal.
All right, thank you, sir. Like this is music to my ears. Like Nigeria achieving 2030 would mean that Africa would be very, very close to the target. So now I am sharing the screen, and then Matthew can take over.
Thank you.
Yeah, Ibrahim, over to you guys.
Okay, thank you once again. Sorry for the interruption. Coming to the CRVS performance in Nigeria, the completeness as at 2021 was 57%. And if you make comparisons, in 2018, it was 43%. But in sub-Saharan Africa, the figure was 44%. The average, and then the certification rate, according to mixed 2021, it was 30%. Then the completeness of birth registration in rural areas in Nigeria is 78.9%, while the completeness in urban area is 44.8%, still relying on the mixed report of 2021. The completeness of birth registration, female 58.8%, while for male is 57.8%, which shows the inclusiveness in Nigeria. We don't discriminate against any gender in registrations. The completeness of death, this is where we are having a lot of challenges. We are still at the rate of 10%, which is not a representation of where we want to be, which means there's still need of more effort on the registration of deaths in Nigeria. Okay, this slide is about the operational readiness assessment that was conducted in 2021. As regards to organizational readiness, the governance structure and accountability mechanism do not drive performance improvements. The CRVS laws do not sufficiently support active registration models, digitized processes, and a fully right-based approach. Then there is the issue of limited financial resources. As regards business process readiness, the existing registration processes are predominantly manual and paper-based, and not uniform or standardized across the country. The service delivery models are often passive in nature, as it's supposed to be both passive and active. And where more active, e.g. at health facility, they are not fully optimized to attain their full registration potentials, because our potentials lies in these medical facilities. Then the demand for registration service is low, and as concerned our digital capabilities readiness, There are major limitations in the functionality of the Vital Regs Pro digital solution that we were using. Then the technical architecture adopted is not fit to be scaled as an ICT system to support CRVS across the country. Next slide. So as regards our key recommendations, they are 8 in number: transformation, delivery, governance, service delivery and business processes, the people themselves, then the technology adopted, data insights and performance management, then the legal framework and the demand side of the registration. Next slide. The operational readiness for high-performance civil registration system in Nigeria. We have the operating model to accelerate CRVS. On the demand side, the public takes action to register every vital event, while on the supply side, service delivery excellent maximizes accessibility and customer experiences. And we have enablers to help us achieve this. One of the enablers is the legal framework, the harmonized laws for right-based and digital CRVS. We have the governance and accountability item on it, the structures and process to drive effective decision making, and the people and performance management, which engage teams with the right skills and capabilities. And the technology, we said the automated system to enable efficient service delivery. And the result is a universal registration and certification of all vital events, then continuous source of high quality vital event data, permanent storage of historic data, then cost-effective and sustainable service delivery model. And the benefits of this realization is the protection of legal rights, accurate, timely, and complete population data for policy making, reliable, trusted, and unique foundational identity, revenue generation, reduced cost of census and household service. Then Nigeria will be known for high performance BAT registration system. Next slide. This is the future state system architecture. We have the National Population Commission that is interacting with the health data base. Then we have the CRVS system. We have the decentralized management, that is state, local government, and world. And then we'll be interacting with national crop statistics and every other stakeholders, service stakeholders, and partners. And there'll be flow of data within these systems, the CRVS system, health sector, the national identity database domiciled in National Identity Management Commission. And to get information that are flowing into the CRVS system, we have at the local registration, we have actors, the self-reporting via the public now, through self-reporting via eCRVS portal. Our registrars at different levels in communities. And then we have our deputy chief registrar who certify all the CRVS document via eCRV web. Then we have our registration agent, additional registration capacity, delegated to other actors at the community level, most especially our health partners. Next slide. Then the CRVS focus to strengthen capabilities to deliver a decentralized CRVS system. We are focusing on 7 different aspects. We have to strengthen the institutional and technical capacity of CRVS and MPC and CRVS partners. Then the social mobilization aspect of it. Then the decentralized and integrated civil registration with primary health care intervention and working with our local government partner. Then the expansion of partnership with our both international partners and local partners like World Bank, NIMC, NIDA, and the immigration service. And then the investment in the legal review of compulsory power restriction act and identity management, including data interoperability systems. And then the expansion of investment in digitalization and scale up civil registration, universal power registration in all the 36 states, including the Federal Capital Territory of Nigeria. Next. Then we have the partnership arrangement to enhance service delivery functions, which include the financial inclusion, the healthcare sector, social safety nets, travel document, employment, voter registration, SIM registration, and this to enhance unique identification system, which will be in partnership with feeding information into the National Population Register through the health system, through civil registration, and through the National Statistics Body. And lessons and enablers. The legal framework, which will give right to data protection, cyber security, digital signature, and then the joint will partnership and governance. Okay. Then the national budget, that is as regards funding allocation, disbursement, and accountability. And then change management that will give strong and committed leadership, institutional and technical capacity, and workforce readiness. Next slide. Thank you so much.
So thank you, Matthew. Thank you very much for a very insightful presentation. Like I'm super excited after looking at all these slides. So Ron.
Yes.
Yeah.
Good afternoon. Yeah, I'm here. And this is what we have done about system integration with the health remote, with the healthcare sector, and we also saw it as a part of accelerating service delivery in the nation. So if I have the next slide.
This one?
So the story, so like I was saying, we kept on monitoring progress, and we're seeing the progress we have made in the last 5 years between 2018 and 2021. We've seen that we have moved from DHS 43% to mix 2021 57%. And then next slide, where we have the SDGs in view. The number of under 5 children in Nigeria is quite huge. So we kept on looking at acceleration, or how do we accelerate? So simply put, if you notice, this graph is telling us if we do something, what will happen? If we don't do, what will happen? And then the plan to reach the SDG. If you look at the observed trends in 2021, quoting the 57% of mix. In 2022, 2023, we're in between this 58, 62%. But if we want to accelerate, and you will see why we're talking about acceleration and the plans we have in place, we are positive that the way we are going, the programs, the plans that we have in place will move us to from 67% to 79% in 2025. And we are positive that we're also going to reach the SDG goals. By 2025, we are likely to be at 85%. So the plan is by 2030, if we want to meet the required SDG goals, which is in the black color that's taking us. But the accelerated trends that we are following, we're positive by, if we're not in 95%, we will be 100%. We told ourselves that if we do not do anything, or if we don't get the required support, we'll probably be at that lower level of 73% at 2030. But we're saying no to that, and we're moving to 100% of SDGs. How did we know we're making progress? We're looking at diagnosing all the problems. Next slide, please. We kept on seeing in Nigeria before now that there are bad registration and opportunities for integration with primary health care. interventions. At least we see that during immunization, this data showed us that there are 5 million children that is immunized, but when we compare the birth registration, is only 3 million. So there's this huge gap that is propelling us to take action so that we can meet the SDG goals as in the previous slides. So we're comparing number of children immunized with number of children registered. That has informed specific actions that we are taking in Nigeria. Next slide. So what did we do? When we look at our 57% under 5 children in 2021, we know that it cannot take us to that 2030. So we have to put intervention in place to increase the coverage, which includes birth registration services within the primary health care programs and activities. Unfortunately, in 2022, the Population Commission, UNICEF, we created and initiated a strategic engagement with the National Primary Healthcare Development Agency. We have high-level political commitment of the executive director of the National Primary Health Care. We have that of the chairman of National Population Commission. So look at opportunities to integrate birth registration with the supplementary immunization activities as of 2022. So what did we come about? In next slide, please. So in 2022, we first of all did a small pilot in 2 states in 4 local governments. Now we're looking towards is an operational research in 2 states to look at, is it possible? Is it feasible? Can we work together? Will birth registration slow down immunization? We looked at all these questions, but we find that 100 volunteers were deployed. Then we're looking at mobile and digital technology to support the process. So we brought in 400 volunteers with their mobile application to integrate with the health teams that were all in the field. And then this thing was done house to house in these 2 states. We're looking at the research, we're looking at what is possible. We're using a digitalized process. And we can see that within 2 months in these 2 states, we're able to register and immunize at the same time, like 18,806 under 5 children in 620 households in 612 settlements in 2 states. When we look at the intervention and the outcome of this intervention, it propelled us to do the same thing in 20 states in 2022. And then we'll be looking at that later. Next slide. Now, when we were on the field and we're looking at the research, this is what we came about. We thought that there are benefits for birth registration system when we partner with the health sector. We see that the health services will leverage on the health services broader coverage in civil registration. Their own services included the outreach facilities, antenatal clinics, community level primary health care services. These were all the areas we worked with the health sector in 2022. We also saw that there's integration of service at the health facility level. We're looking at how birth registration can be fully integrated, not collaborated, but integrated into health facilities. And this is what we're able to come up with. We look at during immunization campaigns, during vitamin A, during supplementation and birth registration. There are benefits to improve birth registration. We look at management and up-to-date records of birth and death, as well as on child immunization cards. We see that there is birth registration component in the immunization cards that is us to identify children who are not registered and making them registered. We worked in the communities and we find that these community-based structures, which often include the health posts, community health workers, traditional attendants, all these are being useful to allow health services to be delivered as close to the population, including birth registration. Now, during the operational research, the benefit we also saw was that the use of health facilities, the frequent contacts between caregivers of young children and health services, help us to reduce the parents or guardians service costs, so that when a mother brings the child to the health service, the birth registration also is provided, and the mother doesn't have to take another transportation or visit again to get the birth certificate. This is what we're looking at. This is what we are benefiting. This is what we're leveraging upon within the health sector. Next slide. So we're looking broadly to the operational research. We came together with the healthcare sector, especially the National Primary Healthcare Agency, and we're looking at this broadly. We're dwelling on this. We're looking at documentations. We're looking at policy. We're looking at SOPs to come up with this. These are the steps. This is what we're doing at the moment. We're looking at the risk analysis. The operational research gave us an idea of the risk analysis there. So we're working with the healthcare actor, the primary healthcare development agencies. Then we move in to the policies, like I said. We're having a big meeting. We're looking at broad stakeholders to look at this policy procedure and how do we implement. When we implement, we need to look at validation. We need to look at the protocols. We need to look at processes. How did we perform? What are the tools? What are the technologies? What we aim this? And then we can enforce collaboration through the chain management, because we're going to the health centers, we're going to health services, we're going to meet us there. The FPC and the PSC and the health sector needs to collaborate and integrate to make sure that we really have change that we're looking at through these integration steps. Next slide. So we went beyond that. Like I said, when we started in 2021, yes, we actually started looking at the integration with technology. And we have the local content. This transfer technology is within Nigeria doing a great work in digital technology. They're supposed to be here, but let me just go on. So we're looking at this is the schematic of what the data system and the digitalization process will look like when we have the child at the center, that this child is offered the birth registration, is registered, this child is offered immunization through the MPCDA and the identity management system, so that we're looking at a holistic approach for the child using this the identity, the immunization, and the registration all together for the child, all at the same time. Next slide. So, like I said at the beginning, that what we practiced in 2021 in only 2 LGAs. All right. So it's just speaking to so that we're looking at when you capture and record the birth of a child. Okay, you're too fast for me. So let me just go. So the schematic, yes. I'm speaking. So for this operation to take place, then the next slide is telling us about the digital system that's being built in the country. Next slide. To do all this, to capture birth, to capture immunization, to generating. The next slide is showing us that yes, we built this digital system, this digital technology. While we have the MPC, where we have staff that can log in, we're just going to demonstrate this code. That we now have the system that you can log into with your password, because data protection is also included. You log in, then you register the child. What do we register? Good. Next slide, Pascal. So this is what we show at the end. When you input. This is the what we take. These are the information we take from the child, the surname, the time of birth, the this, the that. Next slide. Once a registrar logs in, these are all the things that you put in. Next slide. Yes. So you go on, then you look at the particulars of the child, the particulars of the mother, and all that and all that. This is the process flow in the system when we recruited we recruited the volunteers to start, then you go on to the approval of the agent, because we want to make sure that real people are really taking the data and doing a good job. Then you do the birth registration. Between the birth registration, we're looking at sharing data with routine immunization report. The whole of this architecture is to show the sort of the integration that we're talking about. So that with digital technology, we can look at routine immunization system that every child that is registered is immunized, every child that is immunized is registered within the sector. So the report and then the payment and the admin. And I'm kind of rushing it, but this is just the process flow of the digitalization within the healthcare sector. We get on learning lessons that we are building on when in the last 2 years, working with the healthcare sector in 2021, in 2022, now in 2023, we're learning that there are great opportunities to expand delivery of services for children in an integrated manner. We're looking at the collaboration, stronger collaboration, structured collaboration between the national population and the healthcare system. We're looking at birth registration process as an incentive to caregivers for their children to be immunized, because don't forget that this is all about system integration. And we have found out that when we work together, the birth registration does not disrupt immunization process. Why are we talking like this? Because to immunize a child is faster than registering a child. But we're seeing that there's no disruption when we work together. It's a learning process we are on to improve service delivery at one stop. So the child is accessing healthcare services, the child is accessing birth registration services, the data is being computed, and then the services are provided. The digital technology investment we find is critical and for near real-time reporting on both birth registration and immunization, and we're looking at data interoperability within the healthcare system. Right. I think I'm done. Thank you.
Thank you, Sarah. And congratulations. I really liked your energy, and I have a couple of observations. I'm delighted to note that you're focusing on both health facilities births as well as community births, because that is very important in the context of Nigeria. And then you are going for a wide area of interventions. So thank you very much. And thank you all again for joining this webinar. Thank you, Ibrahim. Thank you, everyone.